Young Minds Matter survey is a national survey of child and adolescent mental health. A survey like this comes along once every 15 or 20 years in the life of a nation. It's an opportunity to look at children and young people from the standpoint of their emotional and behavioral development. It's an opportunity to ask, how many children are doing well? How many children have problems? When they have problems, what sorts of emotional and behavioral problems do they have? And what's the consequence of that? Quite importantly, one of the main things that the study tries to find out is, what do people do when they have children and adolescents that are troubled by these kinds of problems? How might we configure good services and good quality interventions, both to treat problems when they occur, but as well prevent them before they get going? Young Minds Matter is very significant. Family life has changed over the past 20 years. Families are being asked to do things that they haven't had to do before. They're often working harder and longer, and the circumstances in which children are being raised and schooled have also changed. First and foremost, we would be reassuring families that we have done this before, that Australian families have willingly cooperated in the past and given us excellent and confidential information about their circumstances. One of the things that we would be reassuring families about is the utter confidentiality and privacy in which we hold that information. No family will be identified. No individual child will be identified within the publications of the findings. The only way we can really plan good services and good programs to prevent these problems is to find out what the circumstances of families are, how children are experiencing life, and what they do when they have problems. The first survey was absolutely instrumental in creating some of the first comprehensive services around Australia for children and adolescents. The first survey actually brought to the attention of Australia and Australians the difficulties that some children experience in their emotional and behavioral development. So it's very difficult to underplay the strategic importance of that first survey. It's been flogged to death. We've used the results from that survey to do all of the planning and development that we can possibly do. It's time to update that information and modernize what we understand families are now faced with and what they do when they do encounter problems like this. In this survey, it's really critical that we engage a high level of participation by Australian families. We need people really putting their hands up and agreeing to let us into their homes and do these interviews. If they don't, the information that we get won't be representative of the circumstances of all Australians. So I'd really be asking families quite carefully to consider what they do when one of our team members knock on their door. Basically what happens is that households are selected at random. They receive a letter describing what the survey is about and noting that an interviewer will approach their household. On the day that the interviewer makes contact with them, that interviewer explains to them what the survey is about and the fact that we do this with their permission and consent. If families are willing to be in the survey, an appointment is then made at a time that's convenient for the family for the interviewer to come back to the household and conduct the interview. Usually the interview is done with one of the parents of the child, but if the kid is 12 years and older, we ask permission as well to be able to give the child or the young person a laptop to fill out some questions on that as well. Families find it a very interesting process. They often get quite engaged in telling the story about their child. The other thing that we're able to do is leave information about the survey with the family, and also brochures that describe services that they may need or be interested in contacting about child development and child well-being. When a family agrees to be in our study, they're doing something very special. They're telling a story about themselves and their child. They're also contributing information about children and families and their well-being in Australia that we're able to put together and paint a picture of how we're doing at this point in time. They're contributing to a greater likelihood that we'll be able to design and implement better quality services at schools, in clinics, in hospitals for children that have behavioral and emotional problems. But they're also contributing some very valuable information about kids that don't have that problem and how they're doing and how they're doing so well. That's equally important in the scope of what we gather.